So to me, to put the kids and with the elderly infirm at the end of life in the same bucket, it's like putting K through 12 education into the military budget. The moment that we are at war, we'll close all the schools because if we don't win the war, there is no future. What are your thoughts on someone saying this is aspirational in the future of our specialty?
Thank you. This is a great comment. I think people have different priorities and different aspiration. I think the intention is extremely good, right? But we will have to come back to money. Like, I'm an accounting professor. I think we don't believe money grow on the trees. We believe if you change incentives, people's behavior will change. If you pay the pediatricians 1/10 of what they get today, you won't get the best and brightest people to enter the practice. And then, yeah, you end up with either rationed service or extremely low quality, etc. So they ignoring physical reality, I think, is a common theme in today's rhetoric or narratives. And the belief that physicians will do whatever, physicians won't reduce supply, won't change behavior if we change the payment system. I think it's just a not realistic understanding of how economics work. I do not believe since there are people who just said, no, there's no such a person. We are all living and working driven by economic incentives. And I also don't believe anybody can design a system from top down with perfect knowledge and design a system perfect for everyone. It won't. It has to be let the people decide, right? That's why we, the people, is our spirit in America. Simply because the planners don't have any clue. I often heard people saying, because government said so. But you know, what is government? Like what you said, the Medicaid, the young children and older seniors, these are people sitting in a building in DC. Do they have superior knowledge? Or do they have a superior experience or superior morality? I doubt it. So we should always question the logic of all these, as you said, it's unreasonable policies. There is really no other force to counter that except for people's awareness. If we question that, if we understand where it comes from and the limitations of the policymakers, we keep chattering. And that will have, I believe, that will have a ripple effect, and that will become a force, and maybe a very powerful force, to prevent all those reasonable policies from hurting the efficiency of the economy. At the end of the day, if we let pediatricians, let physicians have freedom to innovate, to help patients, why would you choose to go to medicine? Of course, medicine pay well, but also you want to help patients to start with, right? I really believe physicians are the key to change, to reform, transform our healthcare system. I'm not talking about innovation just like new drugs, etc., but innovation to save money, innovations to provide affordable care to patients. Like in rural area, like system cannot do it. Private equity cannot do that. But maybe you and I, we can form a very efficient form, and maybe we can make it run extremely fast and not using much labor, but deliver great quality. We can do that if we are allowed to, if we, especially in a very relatively flexible payment system. So that's my thinking about why we have this top journals or publishing people with great intention, but have, I would say, some limited understanding how money and how economics work.
I think what you're describing is practice transformation. Practice transformation transformed from paper to electronic health records to access to care to population health. This is practice transformation. An independent practice is capable to do that because they're smaller, they're more nimble, they pivot, they can do things. If I decide I want to do something in my practice, implement one of those scribe AIs, I can do that. I don't have to have 15 meetings to have a meeting with Dr. Bravo to talk about which one should we get. And then the one that benefits me as a person mostly because it's my friend or something, that's the technology that's picked, even though it's really complicated and cumbersome and the physician will hate it.
Right.
Hospital systems are still the same, maybe with computers, they're more fancy. They have Starbucks and Panera in the lobby. but it's still the same old hospital that we worked in as interns, Herb.
Yeah, I think Dr. Bai's point here is that when there is a central regulator forcing people to do this, everybody to do the same thing, it doesn't work. And when people do not understand basic tenets of accounting and economics, and there's a behavioral economics, a whole science of economics, they will have great intentions and incredibly smart people, but they will propose the wrong solutions. And we saw this already play out. The electronic health record is not a bad idea, but it was a terrible thing for the patient. It destroyed the patient-doctor relationship. It did not improve care. It did not control cost. It spent a lot of money that went to people in California that created EHR companies. And that was just central planning gone awry.